So this session is on finding, understanding and using evidence about nature-based activities for health, and it's mainly aimed at people volunteering or working in voluntary community and social enterprise and related roles in Humber and North Yorkshire. And it's part of a wider training series from Hey Smile. I'm Laura Harrison and I carry out research at the Department of Environment and Geography at the University of York on the relationships between health and nature, including nature-based activities, and my training and background is in ecology. I'm also a co-director of Leeds Mindfulness Co-operative, where I run nature-based mindfulness courses for people with chronic pain and experience of mild to moderate mental health conditions in Leeds and Bradford. So I do have that VCSE perspective and know how difficult it can be to use and integrate evidence. And I'm running this session independently of the University of York and Leeds Mindfulness Co-operative. So we're going to have a very brief overview of some nature and health research areas. Then we'll look at what we mean by evidence-based practice. We'll look at some types and sources of research evidence, how to find evidence, and importantly, we'll look at assessing the quality and relevance of evidence. And then we'll finish up with some more recent developments in finding and using evidence. So we're in the geological age of the Anthropocene. It's a time of climate breakdown and biodiversity loss. And environmental and human health are very much entwined. Improvements we've seen in health are under threat as social and ecological systems change. So nature-based activities for health can be a way of addressing this. We're both improving people's health and social connections. Some of the ways we do this are contributing to nature recovery, and also we're changing attitudes and internal perspectives. So if you'd like to learn more about this, I'd recommend the talk by Professor Peter Coventry, which I've included a link to. So I'd like to give a very brief overview of research areas related to nature-based activities before we look at using evidence. So I work within an ecosystem services perspective. So functioning ecosystems result in benefits that are valued by people. So we get things like food and clean air and water, but also very much the cultural ecosystem services such as recreation, aesthetics, learning, and our sense of place, our cultural heritage and identity. So all of these different aspects support health and well-being. And this very much sees people as part of ecosystems, so human well-beings and activities feed back to influence ecosystem health. So there's a large amount of literature on how exposure to green and blue space is associated with various aspects of health and well-being. So there's associations between the amount of green and blue space, the distance between where you live and the green and blue space and health. And generally this is studied at a population level. And there's research on how this is important to mitigate health inequalities, and initiatives like Green in 15, so having a natural space within a 15-minute walk of where people live, are all based on this work. However, as is common with research, when you start to look more into the details, the picture can look quite messy. So with this aspect, you're having to control for lots of different elements, and the green or blue space can be having an impact on health in many different ways. So it's not only about access to any green or blue space, there's also research on the extent to which different qualities of that space are important. And so for both health and for positive environmental behaviours, we need to not only focus on access to green and blue space, but also to people's sense of connection to nature. So improving the quality of people's experience when they're in the natural space. So we're looking at where green and blue spaces are, the amount of green and blue space in different areas. We're looking at different aspects of the quality of that space, how that influences people's access and enjoyment, and how people engage when they're in green and blue spaces and how that impacts people's health. So this is when nature-based activities or nature-based interventions come in. So both of those terms are used, sometimes in slightly different ways, but there's quite a lot of overlap. So these are organised, structured activities in a green and blue space. They're aiming to improve or maintain people's health and well-being. And I think of them as having three elements. So there's the natural space, there's the activity which you're involved in that space, and then there's the aspects of the group, the social group that you might be with, how that's facilitated and carried out. And different types of nature-based activities which you're probably involved in might be gardening, care farming, so agriculture, looking after animals, various types of conservation work, often linked with nature-based solutions to support nature recovery, combat climate change, and green and blue exercise, various types of ecotherapies, and then all the different types of nature-based arts and crafts. So I've had a look at 12 systematic reviews of nature-based interventions. So this is where people have searched for studies of aspects of nature-based activities in a particularly transparent, systematic way. And in these systematic reviews, there were lots of studies that looked at mental health, such as anxiety and depression, and also impacts on social skills, social functioning and relationships. But fewer studies looked at physical activity, and even fewer studies looked at the physiological aspects of how nature-based activities were having an impact. So my overall summary from these 12 reviews is that we can say that evidence for nature-based activities supporting mental health and social interactions, we can say that's established, although it's incomplete. However, the evidence of physical activity is unresolved, and there was not really enough evidence to look at physiological health. So I should emphasise this is only for 12 reviews, and there will also be many aspects of health that reviews look at. So we can also zoom in and look at particular types of nature-based activities in these reviews. So for example, just looking at the ecotherapy studies, we get very much the same picture. So the ecotherapy types of nature-based interventions were associated with improved mental health outcomes across multiple systematic reviews, but only a few individual studies and only one of the systematic reviews studied physical health outcomes. And with gardening interventions, there was a scoping review that was carried out by Michelle Howarth and colleagues. Scoping reviews are often broader than systematic reviews. They're often done as a precursor to systematic reviews, whereas systematic reviews have a much tighter focus and look at everything about that particular research question. So this review found that gardening and garden activities can be linked to improved mental well-being, reduce social isolation, and increase physical activity. So I think some kind of ongoing research questions of interest are about the impact of the type and the quality of the natural space, how different elements of the nature-based activity interact to result in benefits, and really importantly, how the health measures used represent long-term change that really matters to people. So very often studies are quite short-term, and qualitative research can really go into how this matters for people a bit more. And do people with different needs, health needs, different backgrounds, from different demographics have different outcomes from the same activity? That's really important as well. So coming more locally, I'd encourage you to look at the results of the Humber and North Yorkshire Green Social Prescribing Test and Learn programme, and also the wider and ongoing programme of work that Hey Smile are doing with growing green and blue health. So Trish Darcy and colleagues have recently published a cohort study of adults who took part in a nature-based interventions as part of the programme. They found some evidence that horticultural and care farming types of activities were associated with the greatest gains in mental health and well-being. And they found larger benefits to well-being for people who took part in activities over 9 to 12 weeks rather than just 1 to 4 weeks. So you might want to take a brief pause, look away from your screen, or to reflect on what we've just talked about before we move into thinking about some types of research evidence. So there is now much more of an emphasis on there being a genuine exchange of knowledge between people with different experiences and backgrounds at all stages of the research process. So there's still a long way to go on this, but there is a lot more of an emphasis on practitioners and public being involved in research, becoming researchers themselves in partnership with perhaps researchers from academic backgrounds. And there's also been a really big increase in open access publishing. So this means as a reader, you don't need to pay to read the paper. So this means results of research are just much more accessible, although there can be some downsides to this, as we'll discuss a bit later. So in the live sessions, we had an interactive activity at this point, but you might want to pause to think about why you want to use evidence. So are you motivated to use evidence for supporting funding applications, for your own interest in development, for designing or adapting your activities? Are you perhaps managing a green or blue space and want to know how to do that in a way that's more helpful for people's health and well-being? Are you interested in perhaps using evidence to reach new participants? Or perhaps you're interested in influencing policy change? And it can also be really helpful to reflect on how our previous experiences might influence how we go about working with evidence. So perhaps think about what words come to mind when you think about using evidence. Maybe reflect if you've had positive or negative experiences around using evidence. And are you thinking specifically about research evidence or more broadly? So just a brief step into what evidence is. So there's a huge kind of philosophy behind this, but the Oxford English Dictionary definition is the available body of information indicating whether an opinion or proposition is true or valid. So in our day-to-day lives, we're constantly trying to understand the world around us, and we're using different types of evidence, whether that's consciously or not. And in the sciences, we tend to think in terms of kind of coming up with specific hypotheses, trying to disprove them. And then in the social sciences, we're thinking more in terms of theory and data, looking at meaning, relationships, and interpretations. So for nature-based activities, we're often asking questions such as, is there a difference? So statistical significance, did this just happen by chance? How much of a difference is it? The effect size, is this a big number? Is this meaningful? And kind of causal relationships, what contributed to the difference that we're seeing, and how does this difference or change matter, are often some of the type of questions that we're asking. And it can be helpful to think about differences between quantitative approaches and qualitative approaches. So quantitative approaches, you're collecting and evaluating numerical data, so that might be from questionnaires, for example. And qualitative approaches, the data are actually the words themselves, or the behaviours, or the images. And in general, quantitative approaches, you're more likely to collect a little data from many people, and qualitative approaches, you're a bit more likely to collect a lot of data from few people, but there can also be a lot of crossover. And these two approaches can really be used in a very complementary way, and you'll often see research that talks about using mixed methods, so it's using both of these to really get a very rich picture. So it's really important to think about how we don't use research evidence in isolation to guide our actions and our decision making. We integrate it with expertise and with societal values. And different professions and areas have different approaches to evidence-based practice. So if you're trained in a particular way, you might want to look into what your, say, professional body or what your particular area, that approach to evidence-based practice. And in policy making, we're often talking about evidence-informed policy making to really emphasize how we're using the best available evidence and involving researcher, practitioner, and public knowledge. So it's really important that we're integrating different types of lived and learned experience and patient or participant values. So I've just noted down a few examples of sources or types of evidence. So this is not an exhaustive list, and there are various ways of thinking about this, but I'm particularly looking at written evidence here. So we can divide this into primary evidence, where observations and data of some kind has been collected, and secondary, which very much reports on those existing primary studies or combines them or builds on them in some way. And another important distinction is the peer-reviewed literature. So the most common place to find this peer-reviewed literature is in academic papers gathered into journals. So these are like magazines on a particular topic, a collection of papers, and you now nearly always access them online. So some journals have a very particular tight focus, such as health and social care in the community is an example there, and some might be much broader, like humanities and social sciences communications. And I've also put down the example of People and Nature, which is another journal there. So apologies if you know about this already, but I was quite mystified when I first encountered this idea of papers and journals. So why am I emphasising this peer-reviewed research evidence? Well, it's just because there's a quality control aspect to it. It helps you to be more confident about the content because there's been an independent assessment by experts in that particular area. And it really does help authors to improve their paper and check for mistakes. So it usually happens before publishing, generally by anonymous reviewers, although it can now be happening after publication in a much more open way as well. And people moan a lot about it. There's a whole set of memes online about Reviewer 2. And if you've been involved in the research process and writing papers, you'll know about the importance of peer review. But the real big bad wolf is predatory publishing. So open access to papers is fantastic and really important, but an unfortunate side effect is that there have been some unscrupulous practices where there's either very poor quality or absolutely no peer-reviewed processes. Sometimes you get journals setting themselves up with very similar names to prestigious journals, purely to try to get the open access publishing fees, and actually publishing very poor quality research. Now, this is not a huge problem, I think, in our area, but it is something as a reader to be aware of, that you as a reader need to think about the quality of what you're reading and accessing. And there's a directory of open access journals, which is an index of open access journals, which can show that they've got a good quality peer review process. So evidence hierarchies come out of the idea that some types of studies and evidence can be considered more reliable because they have less bias. For example, if you're measuring something over time, then it might be that for your participants, something else in the environment or their lives has changed that improve health outcomes, and it wasn't the intervention at all. But well-designed studies can control for this bias in the way that they've been designed, or you can statistically control for it in different types of studies. So there are lots of different variations on evidence hierarchies. So I've just put an example here of some types of research. So at the top, I've put systematic reviews because they're a way of being transparent about how you gathered information, and you're drawing information from lots of different papers. So they'll often combine information from randomized controlled trials and controlled studies, and sometimes before and after studies as well. And randomized controlled trials are generally seen as the gold standard because you have a control group that people have been assigned to at random compared with your nature-based activity to see if there is a difference. However, they are very difficult to do, and evidence hierarchies have certainly been criticised, but the main takeaway is to think about what's the most helpful source that is available for your purpose. So for what you're doing, it might be that expert opinion is actually really helpful and really important. So although this has been drawn as a triangle, I often think it makes more sense to think of it the other way up, in that as you're getting less bias, you're being more confident because you've got more independent pieces of information that have been collected in a way that really reduces bias. So generally, it's just important to think both about the quality of the evidence and about the relevance of that to what you're trying to do. So another opportunity for a pause here, you might want to reflect on or review what we've just talked about before we go on into finding and using evidence a bit more. So looking at finding evidence, with all of this information out there, it can be really helpful to use reports and resources that summarise the literature and really place it in context for you. So I've just pulled out a few examples here of national organisations that produce briefings and rapid evidence reviews, such as the National Academy for Social Prescribing. Natural England have a lot of broader publications on links between health and the natural environment, which are great. And then there's a new Nature for Health resource hub, which is a collaboration between NHS Forest, the Centre for Sustainable Healthcare and Natural England. So that's a great place to look as well. And you might have a particular accrediting or professional organisation that produces these kind of briefings and summaries. Of course, Hey Smiles newsletters are fantastic. I'm always amazed at how Anthony manages to pull really relevant and helpful information together. And you can also follow particular research institutions' work, research programs. You might be interested in particular individual researchers, and going to conferences and meetings can be a really great way to stay up to date. However, at some point you might want to search for your own papers and reports. And now, as most people working in voluntary community and social enterprise won't have institutional access to paid for databases, I'd recommend using Google Scholar, as it's free to use and it's relatively straightforward. Now, not all the papers it will show you will be open access, which is where you're not charged a fee or subscription for reading, but there is a lot of open access content on there, and it will focus more on research content than a general Google search, although not everything will be peer reviewed. So when you're using Google Scholar, you can build a list of keywords. You can also click on Advanced Search in the left-hand sidebar, which can be a helpful way to list what you are interested in and what you don't want to be included. You need to really think about the relevance of what you're looking for and the quality in designing your search terms. It's not quite as easy to tailor as some of the other subscription databases, and it's not consistently reproducible as well, so that's just something to bear in mind. So you could open up Google Scholar now and maybe imagine that you are setting up a new craft space activity for adults. You want to get a general overview that perhaps you can use in summarizing your activity or applying for funding, but you'd also like some more specific information about whether this could be helpful for adults and perhaps some ideas. So you could type in nature-based activities systematic review into Scholar and see what you get. You can also use options in the sidebar to choose to return only reviews as well. And then another set of search terms might be outdoor crafts, nature, well-being and health. So I'm pulling out two examples from research at the University of York that came quite high up in the search results at the time of recording this. So for the nature-based activities systematic review, the first result was about young people. And the second result is a systematic review by Peter Coventry and colleagues looking at adults taking part in nature-based activities in the community rather than that being run from a hospital. And for the craft search, the first one was about young people. The second one is a systematic review, but it appears it's not just about outdoor nature-based activities, so you can learn quite a lot just from the short sections of text in Google Scholar. And then I'd like to look at the third one, which is a feasibility and acceptability study of outdoor heritage crafting that was also carried out at the University of York. So a few tips for reading papers. So it very much depends on what you're using it for, but you can see quite a lot just from the title and the text in Google Scholar. Then you might want to click on it and read the abstract, which will tell you a lot. And you might also want to jump down to any particular conclusions or recommendations that are made. So it might be you're then interested to find other information related to that, and the reference list can be a good place to look. And then there's often links in the sidebars that show more recent papers that have cited this one. So that's more recent papers that have said, oh, we've used the research in this, or we're referencing the research or referring to it. But if you want to look at the paper in more detail, it can be helpful to think about the context in which the paper has been written as well as the content to decide whether it's relevant for you. And you could also use some who, why, where, when, what, and how prompts as a way to start looking through the paper and then go a bit deeper. So who were the study participants, who's funded it, who cited it, why was this written, why was it done, where was the research carried out, when was this done, could this be more up-to-date information, or is this an old but really influential study? What type of study or evidence source is it? What is the evidence saying? What do I think about it? How was it carried out? How am I going to use this, and how does this compare to other research that I know about? And the population intervention comparison and outcome framework can also be really useful to think about when reading a paper about nature-based activities. And it can also be useful if you're planning activities. So who is the activity targeting? Who's it for? What is the activity? How long, how often, where? And what's the comparison? So if you're looking at research evidence, are the same individuals compared before and after the activity? Or if you've got one group of people who are doing that activity compared with people who are doing something else or receiving kind of standard care as a control group. And then what's the outcome? Is it the individuals kind of self-reporting that, perhaps using questionnaires about their health and well-being? Or are there perhaps environmental outcomes, broader economic outcomes? How is the outcome measured and what tools were used? So you might want to try this out looking through these example papers, having a look at using those prompts and using that PICO framework. So when you're using evidence in your writing, it's really important to include details of the publication so the reader can follow that up. So if you're writing a summary online, you could simply provide a link to the publication. But some common pitfalls to look out for when you're reading and when you are writing are things like not citing the sources that you've used and maybe not checking what they actually say, perhaps just copying what someone else has used, or directly copying text without using quotation marks or synthesizing in some way, and then just generally misrepresenting, overgeneralizing, or failing to provide important context. So these are really easy to do. I've definitely done all of these things as I'm learning. So these are just things to look out for. So it's generally the best practice to provide in-text citations with the full reference at the end of your piece of writing or in a footnote so that the reader can follow that up. So there are broadly two main ways to do this, and there are loads of resources out there that explain this, and I've put a link at the bottom of the slide. So you can include the author's surnames in your text and the date, the year of the publication, and then you put all the cited references in alphabetical order at the end of your document. Or you can use numbers throughout the document with a footnote or an endnote in the reference list at the end. And if you're reading reports and papers, then I'd really encourage you to consider using reference management software. So it might seem like overkill if you're not a researcher, but I think it can be really great for organising reports and PDFs, and it just helps you to cite correctly if you're writing. So we know that researchers always like boosting their egos and looking at their publications. So I asked an AI chatbot to please list the top 5 most cited publications authored by the researcher Laura Harrison at the University of York. So I'm interested if you think there are any problems with this list. So I didn't write any of these. None of these are real references that have been produced. The links go to different papers. All the titles seem really plausible. Now I just didn't provide enough context to the chatbot about whether I wanted it to be creative or come back with factual answers. So it's put together the most likely answer based on a bio of my work. Now I'm being really unfair because this was 9 months ago. And when I checked recently with various tools, they all got it right. However, it is really revealing to think about what these large language models are actually doing. Essentially, they're coming up with what is most likely based on the information they have. They're very good at recognizing patterns, providing very natural outputs. But I'd be cautious about simply using AI just as a search engine in an uncritical way, because these tools can sometimes be quite confidently wrong and almost seeming too keen to please. For example, if you put the first incorrect reference into a Google search, then you get an AI overview. And the first paragraph very much gives the impression that it is factual, and it explains the paper based on what it knows from other sources. So it's been suggested to me that it can be helpful to think about aiming for a paragraph rather than a short sentence in AI prompts. And I asked ChatGPT for some tips about how to write useful prompts, and then I edited it to get this. So thinking about the context, So saying who you are or telling AI to act as if, providing some source material, but checking that it's not copyright or sensitive. Be specific about who the audience is, what the output is that you want, the tone that you want, and you can provide rules and guidelines. And you can also really iterate your prompts. So to summarize with using AI around research evidence, it can be a really fantastic tool for many tasks, such as summarizing, thinking through alternative ideas, overcoming writer's block, structuring or writing. But it does use a huge amount of resources. There are ethical issues about the material that's been used to do the training, ethical issues for people who need to review content. So I just really encourage you to don't outsource your brain, check for inaccuracies, consider these ethical issues and bias, and really guard your intellectual property. Don't infringe other people's copyright, and check your organization's policies for using generative AI. So the great biologist Edward Wilson said 25 years ago, "We are drowning in information while starving for wisdom. The world henceforth will be run by synthesizers, people able to put together the right information at the right time, think critically about it, and make important choices wisely." So I hope some of this has been helpful in considering how we can think critically about information and put that information together to inform how we act wisely for people and the planet with our nature-based activities. So thank you very much for listening, and I hope this has been useful. And if you are watching this in July 2025, then I'd welcome some feedback on this very short survey.